today we're going to be learning about working with research, how to get our research into the world and making a difference. So today I'm going to introduce Savera Kalideen. She's worked in public health, as you might have read on our invitation, at Seoul City for many years, with a specific focus on alcohol policy change for the last 7 years. She was the chairperson of the Southern African Alcohol Policy Alliance, SAPA, from 2012 to 2014, and she's currently the South African board member on that structure. And this SAPA is connected with and affiliated with the Global Alcohol Policy Alliance. So today Savera is going to speak about the work of Seoul City's program or initiative Phuza Wize, and hopefully you'll explain to us what that title means, Savera. People do get confused. And explain how that initiative combined research, social mobilization, and alliance building in order to lobby for a public health-oriented alcohol policy in South Africa. So thanks everyone for joining us, and Savera, over to you.
Thanks, Annie. Thanks very much to Strive for the invitation for us to talk about our work. And thank you to everybody that's called in to listen to our experience. My name is Savera Kalideen. I'm responsible for advocacy at Seoul City, which is based in Johannesburg, South Africa. And as Annie says, I'm going to speak about alliance building and research for alcohol policy change. Just a brief overview of my presentation. I'm going to talk a little bit about who we are at Seoul City and what we do, about our Phuza Wize campaign, which basically means, Phuza Wize means drink wisely or drink safely, but properly meaning wisely. What we did about establishing partnerships for this campaign and how we used research and what kind of research we used. We use this model here, for our work. Basically, our interventions that we put out there are media-based interventions, which is a drama program called Seoul City for adults, as well as our Soul Buddies program for children between the ages of 8 and 14. We have an advocacy campaign for all of our work, which focuses on lobbying for policy change that will make the healthy choice the easy choice. So that's where we focus our work on alcohol policy, because we don't believe that individual behavior change is possible without a supportive environment. And then we look at social mobilization, basically getting communities to understand the rationale for the behavior change that we're talking about, and looking at what are barriers for communities, which informs our advocacy and lobbying, and also what kind of services communities say they want, because individuals find it very hard to change their behavior if there isn't a supportive environment. And obviously we take those principles, which are on the outer ring there, from the Ottawa Charter, and work within that framework. Just very quickly, our Phuza Wize campaign was launched in 2010. It's actually a violence reduction campaign, because when we were doing our work on violence in the early 2000s up to 2007, as we know, there are very high levels of violence in South Africa, and in particular, there were very high levels of male-on-male violence, which were contributing to a very high death rate, almost 10 times the global average, and then a very high unintentional injury rate. And our evidence, our research showed us that there was a very strong link between alcohol consumption and violence, and we therefore focused the Phuza Wize campaign on alcohol safety. And we came up with several objectives, one of which was to change the social norm, which was very pro-alcohol consumption. And also we looked at legislation. We did a literature review on legislation, which I'll speak to a little bit later as well, and focused on these areas: marketing, taxation, pricing, proximity to schools, etc., obviously taking ideas from the global strategy on alcohol as well. There was a component that looked at individual behavior change, firstly increasing knowledge about the impact of alcohol and then how they could change that behavior. And the community mobilization component would have focused much more on understanding the law, what rights communities have, how they can engage with traders and the police, etc. The components of the campaign were the three that I highlighted: media, social mobilization, and advocacy. And obviously, we couldn't do anything in a campaign if we didn't have research about various aspects of alcohol consumption and legislation in South Africa. And also, we couldn't, as an individual organization, address an issue as broad as alcohol safety if we didn't build alliances. So I'm going to speak a lot more about those for the rest of the presentation. But I just want to show you a graphic that we produced at the time that we had designed the campaign, where we had gone to all of these communities across the country, and we had begun setting up what we called Phuza Wize learning communities, which we designed our social mobilization campaign around. We spent about 18 months working with communities, setting up stakeholder meetings with them, etc., for them to take the issue forward, but we ran out of funding and so had to focus only on the advocacy component of our campaign, although we had some social mobilization components in our Kwanda communities, our Soul Buddies clubs, where we looked at making schools alcohol-free, and our Rise clubs, which are clubs for young women that we started about 2 years ago, young women aged 15 to 24. So we still continue to do some work in our clubs and in our Kwanda communities, but not the way we had envisaged initially. Just briefly, some of the impacts that we have seen on the campaign, even though we haven't done a rigorous or comprehensive impact evaluation because we didn't do the campaign the way we had wanted to. There were many conference resolutions at the Anti-Substance Abuse Summit, which was hosted by the Department of Social Development in 2011, that took on board the Phuza Wize campaign elements. Last year, there was national norms and standards for alcohol outlets that was legislated, that was put through by the Department of Trade and Industry, that had 15 of our campaign proposals in them. Currently, the Gauteng provincial government, the social development department of the Gauteng provincial government, is using the Phuza Wize model of social mobilization, and SoulCity is a service provider to them in that campaign. We had put, as SoulCity, we put the issue, we tried to refocus attention on the link between HIV and alcohol in 2013 at the South African AIDS Conference, where we organized a satellite session chaired by the South African National AIDS Council, where we talked about this link and brought to the fore the existing evidence and the evidence for the region. And because that event was chaired by the SANEC chairperson, we were asked to present this evidence again to all of the South African National AIDS Council's provincial partners and their national partners, which we did together with our own Phuza Wize partner, which is the Medical Research Council, and that link is one that's accepted in the sector now. Focusing on alliance building that we did for the Phuza Wize campaign, we started our work in terms of alliance building in South Africa with the research sector, academic sector, gender-based violence, women sector. So we had people like the Medical Research Council, the Human Sciences Research Council, the Legal Resource Center, the National Association of Advice Centers, organizations working with men as part of our partners, our Phuza Wize partners. And through our work with alcohol, we were introduced to partners in the region, and we joined the Southern African Alcohol Policy Alliance in 2012 and the Global Alcohol Policy Alliance more or less at the same time. For us, it was very important to work with partners in the region because about, this was 2012 when we joined SAPA, but we found through our work in the 2 years to the build-up of our campaign that the industry was really targeting the African region, primarily because compared to other regions, we have a relatively low alcohol consumption. We have a huge youth bulge, and this combination represents a huge consumer base for the alcohol industry now, as well as in the future, obviously, if they manage to get young people to consume increasing amounts of alcohol. And we also found it very valuable to link and understand both what other people in the region were doing locally and globally. And we went for a stronger component of integration of that into our own campaign. So in terms of establishing partnerships for Phuza Wize, aside from identifying our stakeholders, we had to agree on a common set of values. And one of the first very important values was not to work with the alcohol industry. And we learned that from our partners in tobacco in South Africa, that this was their experience, that you waste a lot of time if you build relationships with the industry because they never stick to commitments. So it was much more important for us not to work with them at all, because there's a conflict of interest, so there's no point. And we lost a lot of partners who didn't want to agree with us. And prior to us setting up this partnership, Phuza Wize partnership, other South Africans have tried to work together, and their partnerships had failed on this very issue. So it is a very important one, which continues to get pressure from other civil society wanting to work with the industry and from the industry itself, and sometimes even from government. And so in terms of developing a common platform for working together, we had to agree to restrict it to areas of common agreements, such as public health, for example, and not to use a moral agenda or religious agenda. We also had to focus on alcohol safety, which assumes that people will continue to drink alcohol, and we're not saying that we want a prohibitionist approach to this campaign, so we had to get common understanding on that, and this was collectively agreed on, but obviously we felt very strongly about it as Soul City. We also wanted to bring to the fore issues of violence reduction, keeping children safe from harm, and reducing non-communicable diseases that are linked to alcohol consumption, as well as HIV, which in the South African context is a very big issue. We also did not want to focus on issues that don't cause the greatest harm. So, for example, the alcohol industry would like us to focus on underage drinking and driving, or fetal alcohol syndrome, but the evidence doesn't bear that out. Those issues cause less than 6% of the harm in South Africa, so we did not want to focus on them. We want to focus on the issues that cause more harm. Another thing that we found in the process of building partnerships is this dichotomy between researchers and advocates. We obviously believe and motivate for researchers also being advocates, because they are the experts and their voice is very powerful, especially when talking to media and when talking to government. But initially, I think there might have been, some researchers who feel they want to maintain some kind of objectivity. But of course, research is only valuable if you take it out into the public domain and you use it for policy change. And unfortunately, the normal traditional channels for distributing research, like journal articles and conferences, is not where you would find policymakers, or not where you can influence public debate. There are, of course, disadvantages as well as advantages. I'll just briefly refer you to the disadvantages, which is it's time consuming, it's costly. Because policy change takes so long, 4 to 6 years, we are already doing this now. We thought it would take 4 years to get policy change, but we're in our 6th year, and we're still seeing that we have to do a lot of work. So you have to be in it for the long term. And people who've been in the field for a long time get fatigued and think that we're not going to see any benefit from this work. And we need resources. But of course, the advantages are many and very strong as well. There are many voices that you get when you work in partnership, And when we speak together and have a common agenda, we are taken more seriously. We can share information and resources, and we can harness our different strengths and collective expertise, but we can also grow our expertise by working with each other. Because we work with people from different sectors, our reach extends geographically, because we can work with people in different areas and they can take the same message out, but also strategically by going into the HIV sector, gender-based violence, children, etc. You're extending your reach all the time. Of course, it's important to support each other and to share credit. So with the Southern African Alcohol Policy Alliance, we started work with them in 2012 when we were introduced to them. At that time, there were 7 countries in the region. We have talked with each other a lot since then, in a structured way by having regular meetings with each other. We found we had common challenges linked to alcohol health and also how the industry operates. We set up information sharing networks through web, email contact, through setting up a website. We've done joint training with each other, which doesn't mean that we've done the training. I mean, we've all trained each other. We've shared skills. We've shared strategies. We've developed an advocacy manual together on how to do advocacy. And we did that by bringing all the 7 countries together, identifying issues, asking someone to do the writing for us. And then we tested it with all of the members of the Southern African Policy Alliance in a joint workshop over 5 days. And we've all been using that manual. We've decided on a common focus on alcohol marketing and availability of alcohol, just so that you're hearing the same voice in different countries or the same ideas being expressed in different countries. And we've all also agreed to look at HIV and GBV in our own countries and link them to alcohol. We've also taken our own voice as Southern Africans to the Global Alcohol Policy Alliance and other international venues, and are very happy to be able to speak to our own issue in our own voice rather than having other people speak on behalf of ourselves. And we're able also through these networks to know what is going on in all the countries in the region by engaging in the region and not having to go to, an international conference or a global conference to find out, for example, what's happening in Botswana or Zambia. We already know it before we get there. We survive because we are a funded network, and I think that's quite important for the region because we wouldn't be able to raise these resources ourselves. We've tried, and we haven't been able to do that. So funding is a very important component of alliance building work. For example, the South African Phuza Wize network is now a very informal one. We talk, we meet, we share resources, but we aren't able to do any work together because we don't have separate funding for that. Again, with the Global Alcohol Policy Alliance, it's put us in contact with our colleagues all around the world, and we can draw on their expertise and we can also learn from them. But I think what's also important is we are able to link our local issues to global policy development processes. So as much as we learn from them, we're also able to say to them, but hey, the industry is doing things in Africa that it's not doing in other parts of the world. For example, researchers, and I think Doug, you were one of the researchers that put together an article about the practices of the alcohol industry in Malawi, Zambia, Lesotho, and I forget the 4th country, where basically they sent a consultant to the governments in 4 countries in the Southern African region, and they produced a national alcohol policy, which was exactly the same for all 4 countries, written by the same consultant, and they just changed the name of the country. So those things are happening in our region that are not happening in other parts of the world. So those kinds of things can inform, global policy alliance as well. So just to get back to the issue of research and the Phuza Wize campaign, this is some of the research that we did, and it's quite broad because the issue is so broad. And every time we went out and tried to talk about this issue, there were new questions that were coming up all the time that we needed to get facts on. And one thing that I left out of here was the formative research we did right at the outset as Soul City to go. We went out to all 9 provinces and talked to ordinary South Africans about this issue, about what their views about it, what they wanted government to do, what motivates them to drink, what kind of messages would get them to change their own behavior. And this is just a slide that's looking at, what the health issues were and how big violence was at the time. I pulled out economic related research to speak about because I think this is something that's very important for government to convince them on policy change. And we found just generally, even looking globally, there isn't enough evidence in this area, and there isn't enough cost analysis of alcohol and its impact on various arms of society. And I think it's still an area that needs a lot more work and a lot more investment. We had someone do a very quick budget analysis of the cost of alcohol-related harm and put this against the income from alcohol, and we found that the South African government was spending 1.1 billion more on alcohol-related harm than we were earning from taxes and excise duties. And because I think government and the industry wasn't entirely convinced, they commissioned their own study and that was released, I think, in 2012 in South Africa, which found that the government was spending 37.5 billion per annum on addressing alcohol-related harm. And even if you don't look at the income from alcohol, when you look at that, you know that it's just unreasonable for a developing country such as ours to spend 37.5 billion on alcohol-related harm. The other thing that's important about the economic stuff is that you can't deal with alcohol policy change or alcohol behavior change without looking at the issues that affect South Africans and Africans around our high poverty levels, our high level of underdevelopment, and the high levels of unemployment. These are the issues that galvanize South Africans and Africans because of the pressures that they face in addressing survival issues. So the evidence that we gather for alcohol must take those issues into account if we want to see both the general public and policymakers seeing this as something that they want to address. One of the things that emerged for us out of the cost of alcohol-related harm for South Africa was to say that we need producers to pay, the alcohol industry, that is, to pay for the harm that they cause. And we've been lobbying for the levy on the sale of all alcohol and for this to be used, to redirect it to be used for public health. Just quickly looking at advertising spend, I'm aware that I'm over time, by the alcohol industry in 2009. If you look at just the first 3 figures there, they add up to almost 1 billion by just 3 alcohol producers in South Africa spent on alcohol marketing. And if you go to the last figure there, you'll see that almost 50% of that is being spent during our festive season. I am talking about rands, and it's the rand to dollar rate is, I think, 1 to 13 at the moment. So you can calculate that for your own context. Moving on then to learning from research and why research is so important, which I know that all of us listening, buy into, but just about the way we can use research to frame the campaign and what we should focus on. So for example, when we looked at consumption patterns in South Africa, we saw that it was very high, and they were very hazardous types of drinking almost across the board, even though the individual stats might show that men drink more than women, or that young people, maybe just it's 20% that drink, but we have hazardous drinking in all age groups. We have all race groups drinking. We have all religious groups drinking, and we could find people drinking hazardously in each of those categories. And that's important because we tend to be such a racially divided society, even though we're trying to be better. It's a struggle. So, but the fact that that applies to all of us makes it easier to promote population-wide policies and for government and the general public to see the sense in that. So looking at those figures and reading them in that way made it easier for us to accept the recommendations of the global strategy on alcohol, just because it was easy to see how cost effective they would be, aside from evidence that was available in the global strategy that this is what worked in other countries. I hope that was understood. The other thing we did was we did our own literature review on the legislative environment in South Africa. We saw that 14 different government departments said something about alcohol in their policy statements. We also saw that some of the legislation was really old, going back to 1989. The alcohol policy itself had only been updated in 2003. There were no recent amendments, and very importantly, there was a lack of synergy in the policy at national level, and then when it moved on to provincial level or federal level, if that word's better, or municipal level, so more local level. So obviously, if there isn't synergy at those three levels of government, then you might have brilliant policy at national level, but it's not people's lived experience at the local level. So we made that a big part of our campaign as well. And then the research collectively also showed us that what communities needed contradicted with what alcohol sellers needed. And we made a big distinction between people selling alcohol in communities, basically the traders of alcohol, and the alcohol industry. So we can and try to build relationships with alcohol traders because they are operating, at the interface with the public, and they're not producing the alcohol themselves. But we have a different relationship with the alcohol producers, who we tend to call the alcohol industry in the South African context. So they're not our friends, but the traders, we can be friends with them. Because the traders are the same public that we're trying to influence in terms of positive public health behavior. Again, there was a huge conflict between the need for jobs in South Africa and in the region, and balancing that against harm from alcohol. Our message is that the jobs argument does not hold water, but that the harm from alcohol is and should be responded to very strongly by industry. And then, of course, what I've just showed you about alcohol marketing and how much of money is spent marketing alcohol, and how young people in particular are impacted by that. So some of the people that really struggled with this message about marketing were the advertising industry themselves, the telecommunication industry, especially the electronic media like radio and TV, and the print media, because there's a lot of business that they get. They advertise a lot, but also sponsorship of sports events, festivals, these kinds of things continue to be a conflictual relationship for us. The link to HIV and alcohol, risky sex, the impact on treatment, even when people are taking their AIDS medication, it doesn't work effectively. They might not use condoms effectively after they've been drinking, or they forget to use them. So all of that feeds into the very high HIV epidemic that we have in South Africa and the region. And of course, we found more and more the link between, we found the need to link the existing evidence of alcohol and gender-based violence. And more recently, because SoulCity is focusing on young women, we've done more work in that field and see that the alcohol and gender-based violence link is even more pronounced when we're looking at young women. Obviously, then disseminating this research to government was a very strong part of our campaign, because we took the view that if they knew what was going on, we might be able to influence them in terms of policy. And we used many different formats for that, because you won't get everybody at any single event. Not everyone's going to read any particular publication that you put out. So you've got to do it all the time in many different ways and in many different settings. And so we tried to do that as much as possible to reach government ministers in their own spaces, at their own conferences, at their own workshops, hosting some of our own, using social media, and obviously making submissions on draft legislation as well. Some of the challenges to policy making that we've encountered as we go along is that it's such a lengthy process. You know, we'd hoped that it would be 4 years, but we're currently on year 6, and many of the policies that we want are nowhere near where we would hope they would be, but we've seen a lot of progress. Just yesterday or day before yesterday, new draft was out for public comment. All government departments are not equal, so it's important to have individual relationships with them. For example, we focused on the Department of Health, Social Development, Basic Education, and Higher Education because they are natural allies. People like Trade and Industry, which legislates alcohol, sales and marketing and production in South Africa, not a natural ally, but they've shifted enormously since we started working on this campaign. Treasury, it was mostly neutral, but I think now that they've seen the figures, they've been a closer ally over the last 4 or 5 years. Another important factor that we don't take into account, because we're very focused in our own ways on public health and getting our own messages out there, is that we're operating in a broader context, and other political processes like elections or difficulties that a political party might be having in the public domain around corruption, like in our case, or how the political party is viewed. If a political party feels under pressure for any reason, if they're struggling somewhere else, they don't want to increase more public debate by releasing a policy draft on alcohol, which might put them in a bad light, they feel. So they don't want to add something more to the agenda, that they have to deal with. Political contestation within political parties, within government departments itself, around alcohol is a very strong factor, I think, all over in the region and in South Africa as well. Individuals in government might have more positive relationships with people in the alcohol industry. They might have been on boards in the past. They might still be on board. All of these affect policy making in a very, very strong way. And I think as NGOs, we don't realize the very broad scope of this issue and how much resources it actually needs. So moving on to dissemination of research in the media, again, we try to do this in a multimedia way, using different strategies. I think what's important for alliance building and just for us to understand is to frame the issue outside of health for journalists. And that's why the issues around the economy, around advertising, around the way the industry works, global trade agreements, etc., are important because then you can get other journalists in addition to the health journalists to cover the issue, and you can convince people to put it on editorial pages, not just on wherever they're talking about health, because those are or even on the finance pages, because those are the pages that policymakers would be reading as well, and which would be considered the pages with more currency, than just health alone. We also worked a lot with community radio. They do need a lot of support. They need training on content. They need topic experts. They need financial support just to survive and stay alive. So, for example, when we had elections in 2014, we had a debate on health in the election manifestos, and we invited all the different political parties to talk about that. That's just some of the coverage that we have had in the media over the years. So some of the challenges with media advocacy is to build a relationship of trust with journalists, because they would peg you as a health advocate and sometimes say that you're not neutral, which is bizarre, but that is it, which is why it becomes important for researchers to also speak out, because researchers are seen as more neutral than public health advocates. Of course, you have to be available at very inconvenient times when, you might not be feeling fresh and available to speak about the issue, but you have to do it. There aren't enough people that are speaking out about alcohol in the region or even in South Africa just because there aren't enough human resources. And specifically, we don't have enough researchers and we don't have enough community-based advocates to speak on this. And it's really important to have diverse voices because that convinces both government and the media that this is not a one organization issue. I've also put the issue of donors out there as a challenge because we've experienced some challenges that I think only donors can address for us because we're still trying to find other creative ways of dealing with it. The donor contracts survive for a year or two, or their contracts that live for 2-3 years, and advocacy just goes on, as we see now on alcohol. We've been doing this work for 6 years, so it's not really compatible with the needs of advocacy. I think sometimes that, donors might not be aware of the power and influence of the alcohol industry and don't have a sense of how much support is actually required to do this kind of work. In our case, we weren't able to show concrete evidence of the impact of our campaign after 2 or 3 years, but we were able to show, some policy interventions in 2011, which was just about a year and a half after we started work. So if we had to do an evaluation, we wouldn't have been able to show that, but we believe that out of the impact that I discussed earlier, there's been a lot of evidence to show that we've had an impact, but it took longer. So we might have 200 interviews, but we might not still have had the policy change that we want. But we ourselves do not see that as a failure, but it does not comply with what donors would want to see as proof of impact. And we might get research to do, money to do research on alcohol or gender-based violence, but actually we needed the research to do on economic impact of alcohol. And so it does, so again you would have a challenge finding the resources to do the work to respond to the question that you were asked, because we might have put the proposal in 2 years ago and hadn't thought about economic impact at that time. I'm really sorry that it took so long, but thank you for listening.
That was great. So I think what we've heard, everyone, I'm sure everyone will agree with me, is trying to distill many years of extraordinary work into such a short presentation. So thank you very much, Savera. It's quite an extraordinary range of information, and I'm sure many people have questions lined up to ask you. I think for me, I have a question on nearly every slide just to deepen some of the understanding, because there's so much work and there's so much experience behind it. I thought what I take away from this is a very clear sense of the political nature of research uptake and the importance of understanding the context in many different ways. I also thought your focus on the economic questions and what matters to citizens, what matters to government, all of that is really key to any kind of effective impact. I also wondered about speaking from the point of view of a research organization. For many of us, I think there is a limit to how much advocacy we are able to do, and in some cases even allowed to do in terms of our mandate. I know that's true for some of our partners in different countries in the Southern African region. So I think what is really rich in this is the importance of alliance building and identifying the partners who can do the necessary pieces of the work that need to be done, but that you are not well placed to do alone. Not every country has a sole city to partner with, so that's a drawback for many of us. I want to open up to questions. We have a comment from Priti saying thank you for this brilliant presentation. I think she's working up to a question. In the meantime, I wanted to take the chance to talk about one of the ways that Strive is working on this issue in partnership with Soul City, with ICRW in Asia, International Center for Research on Women, and with the National Institute for Medical Research in Tanzania. And that looks at some of the points you raised about the connection between doing participatory research with young people and then having that experience lead towards the possibility of having young voices in direct conversation with policymakers as kind of giving their experiences. So I think that's an area that, coming out of Phuza Wize, Soul City is taking this issue forward through other initiatives. Doug Endall has a question. Doug, are you going to type it, or would you like to unmute yourself and ask?
I tried to unmute. Is it working?
Yes, here you are. Hello, Doug.
Yes.
Hello, thank you. Thank you, Savera. From my experience, maybe this Phuza Wize and the Soul City activities is one of the most comprehensive and broadest experiences on alcohol policy, covering everything from community mobilization to political issues. So, of course, that's interesting. And another interesting aspect is that South Africa is a very key country, at least for Africa. And every battle happening in South Africa may have at least regional impact, if not global. I know you have had a discussion and a conflict for several years now over regulating alcohol advertising. It has gone back and forth, and would it be possible to give a brief update on it, how the matter stands now and what conflicts you have had?
So in 2012, the Control of Alcohol Marketing Bill was drafted and was sent to Cabinet in 2013. And they've actually, between that time of 2010, when we first were informed that there would be an alcohol marketing bill, and when it went to Cabinet in 2013, there was a lot of pushback from the alcohol industry in many different forms, just disputing the evidence, saying that global evidence does not apply to South Africa. They got the advertising industry to talk about how much money they would lose if they didn't have, the opportunity to advertise alcohol. They participated in many public debates that we attended or were invited to, and they tried to smear Soul City and other advocates as well, including myself, around why we were involved in alcohol work itself and why we were involved in the alcohol marketing bill. They bussed people to public hearings on legislation, and basically they did as much as possible to stall the legislation. And they couldn't kill it completely. They asked for an economic impact assessment, and when that was done, they asked for a second economic impact assessment. And what we understand, the bill went back to the Interministerial Committee, and it was approved to go back to Cabinet. And what we understand is that one or two government ministers, departments, are still not in agreement with the legislation, but that their voices are not strong enough, because the Interministerial Committee on Substance Abuse in South Africa is made up of 11 ministries. So if you've got 2 out of 11 not agreeing, it should be out in the public domain. And we've tried to keep the issue on the agenda repeatedly, but to get the media's interest, you also have to constantly come up with new research, which is where the STRIVE study will help us. Because we did some research with young people earlier this year, and we're hoping to release that evidence very, very soon. And that brings me to another one of the issues that I forgot to mention, Doug, and this still is answering your question, that when we do research, because on this topic, we drew on existing research globally and in South Africa, but we were asked so many questions from 2010 to now that we had to do our own research on to try and respond, because the environment is so dynamic that now when we did initial advertising research, we did it in 2010, 2011, people asked us for more. What do communities say about this? So we did it ourselves, just community research in 2013 and produced a publication, talked about that. But now the media wants more, government wants more. So when we wait for things, for research to go to publications in journals and, academic things, it gets very, it gets delayed and it clashes with the immediacy that advocacy requires, I think also we have a fear that the current marketing bill is going to be watered down, because we're kind of hearing that kind of language. We're hearing language of restriction. We're hearing language of maybe, you can have advertising at certain times and not at other times. And so, until we see it, we can't give you something concrete. But I think the lesson to be learned is that something that started out in 2010 with the full support of the Minister of Health, with a lot of support in 2013 from 9 ministers in the Interministerial Committee, something that went to Cabinet and got high levels of approval, is still not out for public comment. That just shows the power of the alcohol industry in South Africa, but also in the Southern African region.
Thanks so much. That leads on, or part of that leads on to a question from Priti. In your presentation, you said that it is essential to get various government departments on board to address policy issues. Our experience has been that only the national allies get on board, but other departments are not willing to. They don't even want to talk to other departments. How have you overcome this?
Thanks, Priti, for the question. I presume when you say natural allies, you mean, like I was saying, health and basic education, etc. So one of the things we did when we started our campaign, and we understood that there were 14 government departments that had something to say about alcohol policy, we drew up a list ourselves of all these government departments and added a few others that were not there, and tried to say, for each individual government department, what was the threat from alcohol policy change and what would be the benefit? How could we show them a benefit? So, for example, if you look at the Department of Trade and Industry in South Africa, they're very worried about job losses. Their mandate is to give people jobs or find jobs for people or create the environment for jobs. And their mandate was also to regulate alcohol policy. So when we looked at alcohol outlets in the country, and we found out that there were 200,000 outlets. So we said, so 200,000 outlets, they're not selling food. Food is a way to reduce the rate at which you get drunk. Let's put as one of our criteria to make alcohol outlets safer, sell food at the outlet. The other thing we said to them, so you'd have another 200,000 jobs, for example. Then we also said to them that there's high levels of violence at outlets. The research evidence shows us that. So, and when you sell alcohol, people's judgment is impaired. They take more risks. We see lots of violence there. Therefore, we should have a security guard at every outlet, so that someone trained to deal with people as they're drinking, trained to deal with violence, trained to check for weapons and knives, etc., because many of these outlets are family-run business. There, too, you could create employment. So we went down the list of all the government departments and tried to say what matters to this particular government department and how can we show them that by increasing legislation, making alcohol consumption safer in South Africa, that their department's objectives would be met and they would see advantages as well. So you do have to look at your own context and what matters to people in your own environment, and then try to match that with your public health outcome that you're lobbying for.
Thanks so much. There's a question from April Murphy. She thanks you for an informative webinar and for sharing your work. She says, I'm interested to know how you have been working with alcohol traders in township shebeens and what has the response been. I don't know, that leads on quite nicely from what you've just been talking about.
Okay, so we have an organization called the South African Liquor Traders Association in South Africa, which is a national body of liquor traders. And then in every province of South Africa, there's a provincial one. So you've got the Gauteng Liquor Traders Association, KwaZulu-Natal, etc. It's just made up only of traders, where they address whatever issues they are facing in terms of legislation. They build relationships with the police, but primarily they, they focus on training, giving people skills to engage with government and all of that. So we spent 18 months when we started on our campaign working with traders. They were one of our partners. And the reason we did that is because we were being responsive to our context. We have high unemployment. We are grappling with the backlog of apartheid, of low skills, low education, and we understand why people have to sell alcohol as a way of making a living. So we shared, the goals of the campaign and everything, and they attended all our Phuza Wize partnership meetings, and they said they had the same, they told us, but it wasn't true, that they had the same objectives as we did, and we tried as much as possible, to engage with them and understand the constraints. We met with them, went to their conferences, and, we're trying to build an open and honest relationship with them. And also, came up with our safer social spaces criteria for alcohol outlets, 10 of them, in consultation with them, listing the things that, they felt that they could address, but that we knew would also impact on safety in terms of alcohol consumption and in terms of the environment for communities who live close to alcohol outlets, which tend to be predominantly in residential areas in former black townships. So after 18 months of working with them, we realized that they were not acting in good faith. They weren't engaging with their own traders based on their interactions with us, that they brought people out to public hearings. They bussed them into public hearings to give a contradictory message to what they had said to us in our Phuza Wize partnership meetings. We invited them, they were on public platforms with us at our launch, for example. We gave them the opportunity to speak and share their perspective with us about why they need to run their business and how they were going to do it safely, and how they said themselves that they care about the impact of alcohol harm on South Africans, and they weren't doing that. So after 18 months, we broke our relationship with them, but we did not change our perspective that alcohol traders should be a partner in alcohol safety in our context, and that it's not our intention to close outlets, that it's not our intention to undermine them in any way, but that they should run as a business and that they should be aware of safety issues, they should be aware of health issues, they should protect consumers that come into their outlets, and that we're still willing to work with them, but we do have our red lines, and that we're not going to work with them if they are not going to be honest and upfront with us. Another important factor to bear in mind is many outlets in South Africa, maybe up to 50%, but I don't have the figures top of mind right now, are small female-run outlets, and they really are survivalists for families who haven't the skills, who don't have the skills, the education, or the opportunity to earn a living in a different way. And that's really important to us to always recognize that.
Thank you, Savera. We're coming up on the hour, so I think we might have to leave it at that for now. But thank you so much. I think there's an enormous amount of information and challenge to all of us in everything you've said. Just to go to your last slide about the donor challenges, I'm thinking that what's emerging from some of our work is that sometimes pushback from the industry is an indication of impact, a negative indication, but it does tell us that we're having an effect in raising the public health implications of our research. So I hope everyone will join me in thanking Savera very much for this really, really useful introduction to some of the deep work and ongoing work of Salt City in this area. Thanks, everyone, and thanks especially Savera.